I think it's really important for students to see we can't assume anything about anybody just because we see a set of numbers on a paper.
The Collaboratory is a public health space located in Albany's South End, and it provides social assistance such as access to transportation, helping people enroll in health insurance, providing access to food. And we also provide assistance on the medical side of things. We provide health education, health navigation, and we do medication reviews and engage with patients' other healthcare providers. I think the work that students do here at the Collaboratory really gives them a nice perspective of the things that they could do. Not everyone chooses to work in a medically underserved neighborhood, but it really does give them a perspective of, kind of think about where your patrons are coming from, try to understand, what difficulties they may be having when they come and see you.
So there's a lot of people in the community here who are refugees and who may not be as familiar with prevention and preventive care as we are. And so the idea is to encourage that and reinforce the idea that you should go to the doctor regularly, you should have a relationship with that person, and the goal is that will keep people out of the emergency room. For our students, this is their community. Most of them are not necessarily from this zip code, but they all live on campus at least part of their time at ACPHS, and so we want to show them that being invested in their community matters and is important. I love working here so much because it reminds me about why I do what I do and why I'm trying to train sort of future public health practitioners, because you can see that you can make a difference. Just one person, one at a time, one interaction makes a huge difference. How we can help people matters, and how we can teach students to value that too.
So I am an assistant professor here at ACPHS. I'm a clinical ambulatory care pharmacist, and my practice site is Richmond Family Medicine, which is about 20 minutes from the college. So working outside the college informs my teaching because at my practice site, I see all different kinds of patients every day coming in with a lot of questions and different conditions. And then I bring that to the classroom. So I teach one class called self-care, where the students learn how to make a recommendation to a patient who walks up to the pharmacy counter asking for help with something like nausea or diarrhea or a headache. And those types of things happen all the time in family practice where I am. And so they have to use what they have in the pharmacy to come up with a plan for their patient. And so for me, it's the same thing in practice, and I can bring real patient examples to the classroom.
What drew me to the role of being a pharmacy practitioner is that I grew up in a clinic similar to the clinic that I practice in, and it was really valuable for me to see the long-term relationships that the staff developed with the patients, and that was something I really wanted for myself. And it meant a lot to me, and it continues to mean a lot to me, to develop relationships with patients that I've worked with from the time they got a diagnosis to 3 or 4 years later. So working outside of the college changes my teaching in that I feel like it gives it a more human element and that really important clinical experience element. Seeing what I see outside of the college is an important perspective for students to have because it changes a disease state into a human being, and it changes variables into a set of things that you need to consider for each individual patient, and helps them, I hope, to provide better patient care to each patient and hear the patient as a person, not as a disease state.